Good evening, this is James Smith, the creator of BioMemorize, and I wanted to go ahead and do a short but hopefully informative video on blood pressure and these medications that affect blood pressure, but using this amazing formula conceptually. I'd like to show you how we can consider a certain medication and look at this equation to determine how it affects the blood pressure. So we know that the blood pressure here is equal to the cardiac output times the systemic vascular resistance. And we know that the cardiac output equals heart rate times stroke volume. And the stroke volume has three components which contribute to the stroke volume. We have the preload, the afterload, and the contractility. You can think of the preload here as the force exerted on the right ventricle from venous return. You know the superior and inferior vena cava feed into the right atrium, and then it will be dumped into, even pumped into the right ventricle. And that pressure volume there, you can consider the preload. The afterload, you could really consider to be the pressure exerted on the left ventricle, but really it's the pressure that the left ventricle has to overcome in order to pump the blood out of the heart. So there's a certain back pressure from the arteries being a certain diameter, which is exerting a force back on the left ventricle. And the pressure that has to be overcome by that left ventricle to pump blood out of the heart is really the afterload. And the contractility you could really think of as the squeeze. How good is the squeeze of the heart muscle to squeeze the blood out of the heart? So to have an adequate stroke volume per stroke of the heart, a volume of blood pumped out of it per stroke, we need a adequate preload, we need a ideal afterload, and we need a contractility that is a good strong squeeze of the heart. Of course, we know patients will have all different kinds of these parameters based on their conditions. But let's say basically that we have a patient, and in order to adjust their blood pressure by medication, we use a beta blocker. Okay, which of these factors, cardiac output, stroke volume, heart rate, contractility, afterload, preload, systemic vascular resistance, which of these factors is the beta blocker affecting? Well, we know at least one of the ways the beta blocker works is by blocking the beta receptors on the heart, which would be usually stimulated by the sympathetic nervous system to increase the heart rate. The beta blocker is blocking those receptors. Therefore, we are decreasing the heart rate. Well, if we're decreasing the heart rate, then that means we're decreasing the cardiac output, because cardiac output equals heart rate times stroke volume. And if we are decreasing cardiac output, we're decreasing blood pressure. So that's at least one of the ways that the beta blocker works, is by decreasing heart rate. Therefore, we decrease cardiac output. Therefore, we decrease blood pressure. Now, how about the ACE inhibitor? ACE inhibitor works by blocking conversion of angiotensin 1 to angiotensin 2. So there's an enzyme here, ACE. We block it. It's an ACE inhibitor. So this one of the most, if not the most powerful vasoconstrictor in the body, is blocked. So if we block vasoconstriction in the peripheral vessels, the blood vessels of our bodies, we dilate the vessels, the arteries, then what would that do? And what factor would that affect in this blood pressure equation over here? Well, one thing for sure is it would decrease the systemic vascular resistance. That's the resistance, the diameter of the peripheral vessels in our bodies that have to maintain a certain compliance and a certain diameter so that the heart can pump effectively, because it's one big tube. So one of the factors we affect is systemic vascular resistance, which is really a kind of similar factor as afterload. So this would also decrease afterload. So if we decrease systemic vascular resistance and we decrease afterload, by decreasing afterload, that is going to affect our stroke volume, which is going to make our cardiac output more efficient by decreasing the afterload. But because we're definitely decreasing the systemic vascular resistance, we're going to decrease the blood pressure on this side of the equation. So an ACE inhibitor is making the stroke volume more efficient. It's decreasing systemic vascular resistance, so that's going to decrease the blood pressure. How about it? That's just one of the ways for ACE inhibitors. ARBs, we're blocking the angiotensin II. This molecule binds to the blood vessels. The receptor that this binds to on the blood vessels, we block it by this ARB here. By blocking it, we also decrease systemic vascular resistance here because it can't exert its effects. Angiotensin II cannot. But again, this and the ACE inhibitor both have another function which we haven't mentioned yet, but both of these prevent aldosterone from being produced. They block. Because it's not produced, aldosterone, we're going to also decrease sodium retention, which would decrease our preload. So that's another effect that both of these also have, is a decrease in the preload, which makes the stroke volume more efficient. But we, again, the big one for ACE inhibitors and ARBs is this factor. The systemic vascular resistance is decreased, which is going to decrease our blood pressure. Now, diuretics work by decreasing sodium retention. So we're going to decrease sodium retention, and water follows salt. So we're going to decrease water retention. So we're going to decrease volume. So if you're going to decrease volume, which one of these factors do you think would be affected by decreasing volume? Stroke volume. Really, it's going to affect the preload. So you're going to decrease the preload, which is going to make the stroke volume more efficient. It's also going to decrease stroke volume, which is going to decrease cardiac output, which is going to decrease blood pressure. So diuretics also work by decreasing blood pressure. Calcium channel blockers, these could work depending on which one if it's a kind of, I think they're maybe called like a dihydropyridine or a non-dihydropyridine. If it's a dihydropyridine, it starts with D, or a non-dihydropyridine that starts with N, the D, this calcium channel blocker would work by dilating the arteries. So it would block the calcium channels that are needed to constrict the blood vessels, the smooth muscle. So this again, these, if it's this kind of calcium channel blocker, it would decrease systemic vascular resistance up here. And that would decrease blood pressure over on this side. If it's this kind of calcium channel blocker, a non-dihydropyridine is maybe what they're called, this is going to decrease the heart rate because there's calcium channels on the heart muscle itself. Those mainly work by decreasing heart rate. If we decrease heart rate, we decrease cardiac output. If we decrease cardiac output, we decrease blood pressure. Alpha blockers, these work by blocking the alpha receptors on the blood vessels in our bodies. And so these are receptors of the sympathetic nervous system, which would usually constrict the blood vessels to increase blood pressure as a sympathetic response. But the alpha blockers, if we block these receptors, we decrease systemic vascular resistance. Again, by decreasing that systemic vascular resistance, we decrease blood pressure on this side. A lot of these are working in a similar way, just different receptors. Now, nitrates is our last one. These, like nitroglycerin for example, these work by dilating the big vessels, the veins, for example, involved in venous return. So these, nitroglycerin for example, and other nitrates too, would also work by dilating blood vessels. Nitroglycerin, though, would decrease preload. This would decrease stroke volume. This would decrease cardiac output, and that would decrease the blood pressure. Other nitrates, if they dilate the blood vessels in the periphery, that would work again, decreasing the systemic vascular resistance. If you decrease the resistance on this side of the equation, you're going to decrease blood pressure on this side of the equation. So if you'd like me to go over any of these again, you could comment. I can go over them more specifically. These are not the only functions that these medications have, but it is a simple way to go through each of the medications and how they affect parameters in this particular blood pressure formula to understand how they are reducing blood pressure and how they're helping and to have an efficient stroke volume so that we can have an efficient cardiac output, which is really a very important measure for patients' heart health. The cardiac output is a crucial measure to determine if a patient has a healthy heart. So we always want to make the stroke volume more efficient and effective. And so here's some medications to consider in that. Thank you very much.